Dr. Anthony Fauci has been silent as of late, and there might be a pretty good reason for that. It was reported that he underwent vocal cord surgery. This was just recently. Fauci undergoes vocal cord surgery to remove a polyp. The report says he'll be unable to speak normally for nearly a month. So he's been out. Dr. Atlas, you saw, has been put in there. Fauci kind of nowhere to be found. But what's interesting is in his absence, the CDC has made sweeping changes to the coronavirus recommendations. 3 of them to report here. So first of all, they made the New York Times reports that they are now telling people without COVID-19 symptoms they do not need testing. In the article, this is a gigantic situation. In the article, it says the CDC that people who have been in close contact with an infected individual, typically defined as being within 6 feet of a person with the coronavirus, and for at least 15 minutes, quote, do not necessarily need a test, end quote, if they do not have symptoms. Exceptions, the agency noted, might be made for vulnerable individuals or if healthcare providers or state or local public health officials are recommending the testing. So I went and looked at these, and it says if you work in a nursing home or a long care facility, you do need a test. And then it said if you've been in a high transmissible, COVID transmissible area with more than 10 people who aren't wearing masks or aren't social distancing, you don't necessarily need a test.
Really?
So that is fascinating turn of events when it comes to this, but it doesn't stop there. The CDC goes on further. It says it recommends now that the 14-day travel quarantine, they no longer need that. So the CDC no longer recommends 14-day self-quarantine for travelers. The agency removed its recommendations for travelers to complete a 14-day quarantine if they're coming in from the country or even state to state. Now, what I see this doing is this possibly sets up some fights at the state level. We already saw California Governor Newsom say he's not going to adhere to this. So it's almost as if the CDC is saying the federal government's hands off, you states do your own thing. You've kind of been doing that anyway, but now it seems like it's going to be a state situation, which will be very interesting to see how that unfolds. And then the final point on the CDC, and this was July 31st, this was on masking. So this was the CDC's public health guidance for community-related exposure. This is directions for healthcare personnel to follow while making decisions at the community level. So under factors to consider when assessing a close contact, it says, while research indicates masks may help those who are infected from spreading the infection, there is less information regarding whether masks offer any protections for a contact exposed to a symptomatic or asymptomatic patient. So make of that what you will, Del. This is a fascinating chain of events, and it's hitting multiple angles of what we thought the coronavirus response was from the federal level. It's almost rewritten at this point.
It's really outrageous, right? Essentially saying, well, if you're around people that are infected, whether they're wearing a mask or you're wearing a mask, we really can't determine that it has any value whatsoever. I mean, this is what really starts pissing me off. We're walking around like this while in Wuhan, China, that started this whole thing, they are partying like rock stars, shoulder to shoulder in gigantic swimming pools. And, you know, when we look at these stories with the CDC, I have multiple theories on this that are just like, there's a battle going on. It's like, you know, a war going on in my head. And I think about 2 things. One thing is that, you know, Redfield, that's the head of the CDC. Normally Robert Redfield should have been the head voice through this entire thing, but he sort of got sidelined very early on, and Tony Fauci took over. That gave me the impression that Fauci has a different agenda, that Redfield didn't fit the agenda, and I've been suspecting for some time that Redfield does not agree with this. You know, this is a theory. I'm going to put this out. A lot of things we bring up facts, right? But I wonder if Redfield from the beginning was just like, this is a cold, everybody. Like, what are you talking about? CDC's got to make up, you know, 100 million tests right away. And he's thinking, why? All right, I'll make some tests. And then he gets buried for not getting the tests out in time. And he just got rolled over by the agenda train, right? You don't understand. We were going to push a forced vaccination program with this, and you're getting on our way. And so the moment you have Fauci out of the way, it's like Redfield's like, you know what, all of this is ridiculous. It's not necessary. Now, I don't know if he's behind him. I also question now, we know that, as you pointed out earlier, Scott Atlas is inside of the White House. Is he somehow involved? We know that Scott Atlas, Dr. Scott Atlas, who's now on the the recovery team for COVID-19. We know that he's been very outspoken on simply protecting those that are elderly and at risk, but the rest of us getting out, let's get to herd immunity, let's move on so that we can save the economy, something that we have been talking about for a very long time here on the High Wire. All of these things would seem to say, you know, asymptomatic carriers mean you're healthy people, you don't even know you have it. And there's an added benefit to this, right? Number one, we get to herd immunity quicker. Number two, we pound the hospitals. As soon as people are running in the hospitals, get tested all the time, you're distracting your doctors that need to care for that acute group that are coming that actually have symptoms. And I also think you have a hypochondria or, you know, a psychosomatic event that if someone tests positive, they're going to rush into the doctor when maybe they didn't have an issue before. And I think most importantly, what really could be behind this and should be is here Donald Trump, you know, again, the President of the United States of America. I'm not choosing sides on this. I'm just saying this is the guy that's leading our country right now. He did everything he could to fund all the extra testing, right, so that we could contact trace the entire country. And all the media did was make a headline over the rising numbers of COVID-19, and the president kept saying, we are just doing more testing. The numbers are going up because there's more tests. We're just more aware of everybody that has this cold. And yes, it is a cold. It may be a bad cold, but you can't argue with me that this isn't a cold. A coronavirus is one of the viruses that we call the common cold. So all of a sudden, the media keeps trying to scare us. But you know what they did? They scared us out of being able, they scared Europe out of allowing us to travel there, and China out of allowing us to travel. We have essentially locked ourselves in a prison in America because our newspapers that are clearly funded by pharma and other interests are trying to scare us and therefore are scaring the world and destroying that reaction, that ability to travel because of the misrepresentation that's going on here. So I say good on them. What difference does it make? Whether or not, the numbers are going up because we're testing more. And I think that you take it away. And my final question would be this, Jeffrey. Honestly, what single advantage have we seen from all of the testing? Have we seen some? We don't see products. I mean, you're testing people, you're freaking them out, and then every time there's a product available to them, you make them terrified of the product. So we're basically testing you and telling you the only thing you can do is absolutely nothing, and if you get really sick, let us ram a ventilator down your throat, which Dr. New, I know you're watching. He's like, Del, they don't ram ventilators down your throat. The ventilator is the entire machine, it's the intubation tube. I get that, Dr. New, but here's the point. What advantage have we had? We keep saying all of this testing is going up. We've recognized that if we're going to open our restaurants, if we're going to open our offices, at some point, it's just going to go up. We're going to have to let people get this illness or stay locked down, what should be 2 or 3 years if you want a safe vaccine. So what are we going to do? Just destroy the world as we know it? Have like food shit? We can just drink syrup as a food because nobody can produce anything? It's a ridiculous approach, and the testing just gets in the way of reality, which is Sweden's already got, herd immunity. China either has herd immunity or doesn't care. If we want to be in the game, if we want to hold on to this nation, I think we need just to move forward. If you like that clip, then be sure to check out our live broadcast of The High Wire every Thursday morning at 11 a.m. Pacific Time. You can watch it on Facebook, iTunes, and Twitter. We'll see you there.